Healthy people in sustainable communities. That is our vision at the University of Washington School of Public Health. Here is what drew some of our students here, what they found, and what they hope to accomplish after they graduate.
I chose to pursue a degree in public health because I was working in a community health clinic and I felt frustrated with kind of the lack of resources available for our patients, particularly our uninsured and immigrant patients, and I wanted to get the skills and the education to make some change in that area.
I kind of slid into public health work. I was working overseas. I was in Cambodia doing development work, and as I was working in that field, I felt like I needed more skills and training. I didn't know what I was doing, and I felt like I wanted to be equipped so I could serve better in that capacity.
So my undergraduate years were at a historically black college, a university, abbreviated HBCU. I was constantly reminded of the different public health implications that face low-income people, particularly the lack of green space for children to run around. Ambient air quality standards were pretty low in those surrounding areas.
Originally, I came into my undergraduate experience thinking I would focus more on something clinical based, but I started to realize that I was more interested in making a bigger impact on a more population level.
My family actually lost a sibling because we didn't have access to healthcare. And that's something that is not just unique to my family, but it's happening to families all over the world, and it's happening in our country today. And by choosing public health, I feel that I'm working to prevent that suffering in other families.
I learned through nutrition that public health can have a huge impact on our community and our society as a whole. So I started looking into public health programs and saw that UW really stands out and is one of the best in the country, and it's on the West Coast.
I chose to come to UW because the University of Washington Biostatistics program is one of the best in the country, and because the faculty here are excellent in research in a wide variety of areas, but also really very supportive.
I've been very, very impressed with the student body here. In fact, that's been one of the most enjoyable things. It's just getting to know my classmates, and everyone has really interesting stories and experiences and just really positive.
When I was looking for graduate programs, I was looking for something that was going to challenge me, give me exposure to the communities I want to work with.
I see that diversity has manifested itself in so many ways throughout our school. We have diversity of ideas, we have diversity of career paths, we also have diversity of occupations.
So I'm very interested in, when school is over, working with populations that may have some barrier to a certain type of health behavior, and meeting that gap and trying to educate individuals to take better care of themselves and make better choices for their health.
I want to work on improving access to mental health care in a global setting. I'm specifically interested in working with folks who've had ongoing physical and sexual trauma and kind of working on improving access to care.
My eventual goal after graduating from here is to gain a little bit more training and then to go back overseas. My goal very specifically is I want to mentor, train, and teach public health professionals in developing countries.
I want to be a registered dietitian and work clinically with maternal and child health. And specifically, I'm interested in children with special health care needs.
I'm a big dreamer, so I want to see the Healthy 2020 goals be realized, but that's going to take a lot of work, and it's going to take a lot of us working in different areas to achieve that.
We students will transform our communities. We will make them healthier, stronger, and more sustainable. Join us at the University of Washington School of Public Health.